Hi, I'm Dr. Tariq Karim. I'm a medical consultant, American board, currently working in UAE. Today, I'm going to talk about all you want to know about the weight control medicines, past, present, and future. So, let's start our discussion about the medicine. The first person who described the attempts to lose weight was a Greek physician called Soranus of Ephesus. He was a Greek physician, and he came up with the regime of laxatives, purgatives, heat, massage, and exercise. And this was the mainstay of the treatment for the management of weight for about 1,500 years until in 1920s and 1930s thyroid hormone was discovered, and they came to know about the function of thyroid hormone, that it increases the metabolism and makes a person to burn out his calories, and it became very much in fashion. But the problem with the thyroid hormone was that it caused palpitations and lack of sleep. So off and on it continued to carry on, but eventually it went out of favor. But there are still people who are using thyroid hormone. I've seen some patients who are using thyroid hormone just to lose some weight. Then came the idea of thyromimetics. These are the substances which act on the same receptor as the thyroid hormone, but they don't have the side effects of palpitations and sweating and lack of sleep. But the problem with the thyromimetic drugs came out that it caused the problem with the cartilages in the animal models in which it was tried. They had the problems with the cartilages, osteoarthritis, growth deformities, and then it was also taken out. Actually, it never came into the market, the thyromimetics. Now I'm going to talk about ephedrine. Ephedrine is a compound which is derived from the plant ephedra, and it is got the same effects as the adrenaline, but it is less potent as compared to the adrenaline, so less side effects. It is basically used as a bronchodilator in the cough medicines. And in the animal models, it was found out that this medicine causes thermogenesis. It increases the metabolism of the body by burning the brown fat in the animals. As humans do not have a lot of brown fat, so it increases thermogenesis by and stimulating the muscle cells. So it increases the metabolism, decreases the weight by increasing the heat production by the body. Now, it is usually used in the circle of the bodybuilders with the combination of caffeine and aspirin, as caffeine is also a stimulant and the stimulant of the body. So it is used with aspirin and caffeine as a combination called EAC, and this combination is usually used by the bodybuilders few days before the bodybuilding competition to cut their fat and make their body look more chiseled in these patients. Now, this is not allowed to be used for the weight loss by the FDA, but there is a study which was a 2021 systemic review. I'm going to read it for you. Found that ephedrine led to a 2 kilogram weight loss greater than the placebo, raised heart rate and reduced LDL and raised HDL, with no statistically significant difference in the blood pressure. So there are both pros and cons for this medicines, although it's not approved. Now there's one thing very important that you need to know about this ephedrine. Ephedrine cannot be used along with certain antidepressants. These are called norepinephrine dopamine reuptake inhibitors, just like the bupropion. If you take these medicines with noradrenaline, it can cause convulsions in the patients and cardiogenic cardiac arrhythmias and other side effects. Now, this is a very interesting medicine. This is called 2,4-dinitrophenol. I will show you the picture of dinitrophenol. This is the one, dinitrophenol. Basically, this medicine is used as the insecticide and pesticide, and also it is used in the production of explosives. In the humans, it was found out that the medicine acts on the mitochondria. The mitochondria take the glucose and converts it into ATP, the energy storing molecule. Dinitrophenol inside the mitochondria breaks down this conversion cycles, and instead of energy getting glucose energy getting converted into ATP, this is lost as a heat. And here is where the side effect of this medicine also comes. What happens is, because it loses energy in the heat, sometimes it can cause this malignant hyperthermia syndromes, a severe fatal condition. So this is why this medicine was taken out of the market. But because its effect of weight loss, it has been used on the dark web. Nicholas Bukansky, a Texas physician, in 1986, up till 1986, was providing the patients this medicine dinitrophenol illegally, and he was convicted in 1986. But for the next 22 years, he still continued prescribing this medicine and providing these medicines to the patient until he was convicted of manslaughter for selling of DNP for human consumption. The same thing happened to another English court of appeal, wherein this seller was again convicted in 2020 for the gross negligence manslaughter. So this medicine is so much being exploited in the black market, and I'm pretty sure there will still be some people selling this market in the black market. Okay, now we're going to talk about another medicine called Obetrol. Obetrol came into fashion, as you can see in the ad, being shown as a big weight reducer medication, and it was sold in America by the company called Obetrol Pharmaceuticals. This medicine is nothing but a combination of alternative amphetamines. So it was simply amphetamine addiction which was causing these patients to lose weight. So this diet pill was taken out of the market in 1960s, although in 1950 and 1960 it was very popular in America. Now this is another medication which was very much in fashion in US in the 60s and 70s, and this was called the rainbow pill. And as you can see there, it became so notorious that there was an article in Life about this medicine called the dangerous diet pill. It was coming with different names. One of them was Clarkotabs for obesity, a lot of promotion for these medicines. Basically what this medicine was, it is a combination of thyroid medications, amphetamines, diuretics, digitalis, laxatives, and at that time the barbiturates was added to counteract the effects of this the stimulants that they were being given. It was very popular at that time in America. There was actually some clinics where the physicians were just giving rainbow pills, prescribing rainbow pills and selling them out of their own clinics to the patients until in the late 60s, the American FDA stopped this marketing of this medicine, but still it was being given illegally. And then this whole company and the whole product moved on to Brazil, because at that time in Brazil there was no restriction on it, and it went there for 5-10 years. And then when the Brazil also banned it, it went to the Spain, and in Spain it was being marketed for the medicine to lose pills for again next 5-10 years. But now it is banned all over the world. But still, there's a dark web and there are illegal sites on the internet. They're still providing these medicines to the people. And even these rainbow pills are mixed with the diet medication, with the herbal over-the-counter diet supplements in different countries. Now we are going to talk about the fen-phen, very famous medicine of the 90s. In 1959, phentermine was approved for the loss of weight. But the problem with phentermine was that it was very quickly acting and its half-life was very short. And then in 1973, the medicine fenfluramine came, and fenfluramine had a longer lasting effect, and the combination of phentermine and fenfluramine provided a great weight loss by its anorexigenic effects. And there was an average weight loss of 7.5 kilogram in 24 weeks as compared to 4.4 kilogram under placebo. Now, it was heavily marketed, was used by everybody until it was found out that this medicine causes pulmonary hypertension and also valvular heart disease. There were a lot of cases of valvular heart disease, deaths, morbidity, and that's when it was taken out of the market. Now we're going to talk about the medicine called sibutramine. It was promoted in the 90s and as a good weight loss medication for the treatment of obesity. And it kept on going till 2010 when it was taken out of the market because there was an increased incidence of strokes and heart diseases associated with this medication. But its effects were good and it caused some weight loss, and because of that this medicine is being slipped into the dietary supplements from Chinese companies, over the counter herbal preparations. Each lot of samples have been found to have sibutramine inside it. It was marketed with the name of Meridia, but then in 2010 it was taken out of the market. Now we are going to talk about the clenbuterol. Clenbuterol is a medicine which has been made famous by the stars like Victoria Beckham, Britney Spears, and Lindsay Lohan because they swear to its effect on their bodies. They showed it on the TV, and a lot of people got for it. Now, this medicine is actually a bronchodilator, and it is used in the animals as a bronchodilator and used in the horses. But there are certain effects in which it was seen in the animals and then it was used in the animals to gain muscle because it burns down the fat in the animals and increases the muscle mass by its genetic effects. So it was then promoted into the humans, and there is in the bodybuilding world a lot of you can see movies on the videos on the YouTube that this medicine is being used to promote this chiseled body because it burns the fat over your body, increases your muscle mass, looks you more chiseled, and there are a lot of uses of this medicine, but it is not without its dangerous effects. Actually, there was a person, Odalis Santos Mena, a Mexican fitness influencer. He died after he took this medicine, after he was taking this medicine on a regular basis, and then he went for a surgery for the removal of his sweat glands from his axillary area, and the interaction of the anesthesia medicine and this clenbuterol caused in this patient fatal interaction, and he died on the operating table. And that's why it is not allowed in the humans to be used, but still it's being used. Now, it's a clinical study performed on a young healthy man. It was found that, I'm going to read it for you, clenbuterol increased the resting energy expenditure by 21% and fat oxidation by 39%, whereas the carbohydrate oxidation was unchanged. This medicine was actually came into the medical use in 1977 in the animals, and it was discovered in 1967 and patented at that time. Now, this is another medicine which came up with the idea that you see the people who smoke weed, they get very hungry, and it was found to be because of the cannabinoid receptor CB1. So they thought maybe if they block this cannabinoid receptor, they will the person will lose his appetite. And yes, they came up with this medicine, the name Acomplia, and it was approved for obesity in 2006 as an agonist of the cannabinoid receptor, but it was found that it caused a lot of psychiatric reactions and it also led to the suicides in the patient. That's why it was taken out of the market. Now we're going to talk about the lorcaserin. Lorcaserin is a medicine which acts centrally. It acts on the serotonin receptors in the hypothalamus and suppresses the appetite, thereby causing the loss of weight. And it was marketed with the name of Belvic, and it has quite good results. But then it came to be known that it causes the increase in the incidences of cancer. The incidence of cancer was increased in the patients who were using this medicine. So it was taken out of the market in 2020, but there are still people who only responded to this medicine, and they're still wandering around why this patient this thing wandering around why this medicine was taken from the market, and they're still looking for it. But because of the increased incidence of cancer, it was taken out.